Hello everyone, how are you doing? I hope everyone is doing good. So, welcome to another video of reproduction in humans. So, as we said, in the previous videos, we have covered pregnancy, what is placenta, role of placenta, structure of placenta, then what is parturition, stages of parturition, what are the hormones involved in parturition, how are they regulated, okay, lactation, all this is covered in the previous video. If you have still not checked out, please go and check it out. So in this video, we are going to cover about the methods of birth control. In this video, we are going to focus on a temporary method, and in the next video, we will see about the permanent methods. Under temporary methods, we are going to see natural, chemical, and mechanical barriers that can be used to control birth. So let's begin with the first method, the natural method, which is natural method. It is also known as the safe period, or it is also known as the rhythm period. Remember, we have begun with the temporary birth control measures. Temporary birth control measures. And in that, the first one is the natural method or safe period or the rhythm period. It is also known as the calendar method. Basically, if you remember the menstrual cycle and if you remember the ovulation, it happens around day 14, that is 13, 14, 15, plus or minus 1 day. So at this stage, the egg is released, and after the egg is released, the egg waits for the sperm. So if there is intercourse or sexual activity during those days, then the chances of egg getting fertilizes more. So the chances of the female getting pregnant is more. So if anyone does not want the pregnancy to take place, so the individual has to avoid any sexual activity during those days. So hence it is known as unsafe days. So basically, 14th day the ovulation happens. So we take a buffer day of 4 days prior and 4 days, 3 to 4 days after. Okay. So during these days, the individual should avoid any sexual activity for having birth control, which is natural method, a temporary method to control birth for the female to not get pregnant. So this is the precaution that can be taken from the individual side. Okay. These are the low risk days where the female can have a sexual activity if she is trying to prevent any pregnancy to happen, or if she is trying to control birth. So these days, so this is known as the safe period. These days from here, from the 8th day of the cycle till the 20th day. So 28 days cycle that we refer to, okay, in which the initial phases are the menstruation phase, there is the bleeding takes place. Okay, after that, from after 2-3 buffer days, then till from the 8th day till the 20th day, any intercourse should be avoided for the natural method to be successful. Okay. So these days may be unsafe if 28-day cycle varies as much as 8 to 9 days between shortest and longest cycle. So this has been taken for on the safer side from the 8th day to the 28th day, because some women have longer cycle, more than 28 days. Some women have less days of menstrual cycle, so they get very frequently in 20 days also, 15 days also. So that is why this buffer period has been chosen for not to have any sexual activity. Okay. So if intercourse happens on these days, then the live sperm remains in the uterus or the vagina, which can travel to the uterus and the fallopian tube, and it can fertilize the egg. Okay. So to reduce the chances, then no intercourse should take place. So this is the first method that can be used naturally to avoid any pregnancy to take place. Second is withdrawal method, or we call it as the coitus interruptus. Okay. What is this? That is, at the time of ejaculation, the male will pull back its penis. Okay. So basically, the removal of the penis from the vagina just before the releasing of the sperm. Okay, so the man can ejaculate outside the vagina. That is, it will help in keeping the semen away from the external genitalia of the females. This method is known as coitus interruptus, or it is known as also pulling out method or withdrawal method. So in this case, the male's semen or the male's sperm is not getting inserted inside the vagina. It is outside the vagina. So chances of the sperms getting inside the vagina and traveling through the uterus and fertilize the egg is very, very less. Okay. Another third method, third temporary method of birth control is absence of menstruation. Okay, absence of menstruation. Another technical term is lactational amenorrhea. Now, what is lactation? Now, in the previous video, we discussed lactation. Lactation is when a mother is feeding the baby. The milk which is coming out from the mother's body soon after the birth, that is known as lactation. So naturally, it is seen that women who actively feed the baby, they have these hormones which will interfere in the menstruation to take place. So in those female, naturally, second pregnancy to take place is very, very rare. So frequent breastfeeding, that is intense suckling action by the baby, it disrupts the release of discourages or does not allow to the full the secretion of the gonadotropin releasing hormone. And we remember gonadotropin releasing hormone, it causes FSH and LH to release, and FSH and LH causes the uterus to the ovaries to start making developing eggs, and then if the eggs start developing, then they can be released and the egg is there in the female body. Yeah. So because the GnRH is not released properly, irregular secretion of the gonadotropin releasing hormone, so this FSH and LH is also not released properly. It interferes with the releasing of this follicle stimulating hormone and luteinizing hormone. And because they are decreased FSH and LH, this will cause interference, disturbance in the development of the eggs in the ovary, and this will suppress the eggs to be formed. That is, ovulation most likely will not take place, all because of the intense suckling of the baby. The baby has just born, and this causes disruption in the GnRH. So this is the chain reaction, and during all this phase, mostly the female will not experience any menstruation, and because there will be no egg, so no egg, so no the fertilization can take place, because there is no, even if the sperms are there, even if the sexual activity has taken place, there is no egg, so the sperms will have no one to fertilize. So that is why the pregnancy can be avoided. So natural temporary method of birth control. Another method is those who are about the natural physical methods. Now these are the temporary physical methods, and this is temporary chemical methods. So we are on a temporary only. This whole video is about temporary methods of birth control. So the first category was physical, that is either during the coitus interruptus, or a safe method, that is a rhythm method, and the suckling of the newborn causes the hormone imbalances. And now we move to the chemical means. So an individual can use certain chemicals to avoid pregnancy for a certain period of time. So in this, chemicals like foam, tablets, jellies, creams can be used by the female partners. Okay, yeah. So you have spermicidal, which kills the sperm. That foam, that cream, or the female contraceptives can be used. Okay, tablets can be used or inserted. Spermicidal jelly, that which kills the sperms. Spermicidal means killing sperms. So this can be applied in the vagina of the female. These chemicals are introduced into the vagina, which are there in the mucous membrane, and this will kill the sperms. This will not cause the sperm to move. So even if sexual activity takes place, the sperm will be there, it will be killed, it will not travel forward to fertilize the egg. So this is one method of temporary birth control. Another is mechanical or barrier methods of controlling pregnancy. For example, use of condom or use of rubber sheet, which is placed to stop the sperm entering the vagina. This is also helpful in preventing any sexually transmitted disease, that is venereal diseases. Then femidome is the female condom, which is worn by the female. It is placed inside the vagina. This prevents the entry of the sperm. Also helps in preventing STDs, sexually transmitted disease. Another thing which is known as diaphragm, that can also be used. It is dome shaped, made up of rubber. It can be fixed in the cervix, not at the vagina, but in the cervix. So if this is the vagina, cervix is somewhere here. Okay, cervix is somewhere here, and vagina is here. So female condom can be worn up till here, and cervix is a little inside. So this diaphragm has to be fixed inside. This has to be done by a doctor. This will also do what? It will prevent the entry of sperm into the cervix. Another mechanical means is using of the IUDs, that is intrauterine devices. What are these intrauterine devices? Basically, they are these small devices. You can see like this or this. There are two types, hormones and copper base. These T-shaped devices which can be inserted into the uterus. So you have 3-level protection. First level at the vagina, second level at the cervix, third level at the uterus. So vagina, here you can use a femidome. Here you can use the diaphragm. The diaphragm can be applied here. This is how a diaphragm looks like. You can see in the diagram over here. Or if you want to make more safety, if you want to have more safety, you can use intrauterine device. So you can see IUD, which is inserted inside the uterus. Okay, at the uterus. This is done by a doctor. Plastic coated copper coil. Okay, it is a plastic coated. It will have copper in it. It is inserted into the uterus. Basically, copper ions which are released from this IUD, it kills the sperm. So the action is like that. It kills the sperm. It affects the motility of the sperm, and then the sperm cannot travel all the way here to fertilize the egg, which is released from the ovary. So that is how the sperm will be inactivated here itself. Okay, so it will prevent. Also, it will prevent the implantation of the blastula. Also, if there is any if at all the fertilization takes place and there is implantation, because the IUD is over here, it is releasing these copper ions which will not cause the blastula which is formed to implant inside the uterus. So that will be avoided because of this device. Sometimes hormonal IUDs are also inserted. These hormones will be those hormones that interfere with the implantation and blastulation or the pregnancy to take place. Okay. So to any type of IUD can be inserted depending upon personal, preference. One more barrier method is known. One more device, like you can see over here, this Lippes loop. This also can be inserted in the uterus. It also acts as a temporary birth control, which is known as contraceptive. This attracts macrophages with increased phagocytosis of the sperm. So this Lippes loop attracts your macrophages, which are phagocytic in nature. That is, they will eat up the sperms. They will do phagocytosis of the sperms. Okay, so in a way, they are killing the sperms. They are eating the sperms, making it unavailable for the egg, and hence fertilization will be avoided. So you have copper releasing intrauterine devices suppresses the sperm motility and fertilizing capacity of the sperm. Okay, so this is the mechanical means or the barrier methods which can be used as a temporary birth control measures. And physiological, lastly, The oral contraceptives, the pills, the tablets that can be taken by the female. Okay, these pills are basically hormonal in nature, which will have progesterone and estrogen in them. They will do what? They will inhibit the egg to be released, and also they will affect the quality of the mucus of the vagina. So the vaginal environment is now made unfavorable because of these tablets, because of these hormones, unfavorable for the entry of the sperms. Okay, so these different tablets have different mode of action. Some might kill the sperm, some might make the vaginal environment unfavorable, cervical mucus, they might alter the quality, which will not allow the entry of the sperm. Some might inhibit the eggs to be released. Okay, so these are all tablets and pills which will be composed of hormones and certain substances which will carry out this function. Okay. The birth control implant is a contraceptive used by the female. So all these oral devices, all these physiological oral contraceptive obviously will be taken by the female, not by the male. Okay, another physiological device is this stick. Okay, this is known as a stick, or you can just call it as a implant. This is implanted under the skin of the female. Under the arm, you can see over here in the picture. This also contains hormones, progesterone and estrogen. And the mode of action is similar, exactly similar to that of the pills. But this can be used for a longer period of time. For example, pills is very temporary, like few days it will be effective, few days in a month. This can go up till, you can use it up till you just implant it and you forget it for 3 to 4 years to avoid any pregnancy. One example is Nexplanon. Yeah. This is another device which can be used by female, which does not cause, which avoids pregnancy. So this is also temporary. Till the implant is there in the body, chances of you getting pregnant is very less. Once you remove the implant, then your body comes back to normal, and then you can become conceive as and when required. So that's all in the temporary method of birth control. In the next video, we will see the permanent methods of birth control. Okay, and that you have various small subtopics like the MTP, infertility, IVF. Okay, okay, permanent methods of birth control, and then we will move to certain side topics, which is infertility. That is how fertility can be improved by doing in vitro fertilization, GIFT, ZIFT, and ICSI. So these all we are going to see in the next video of this chapter. This will be the last video. This is the last topic of your chapter. So keep revising. If you have any doubt, make a note of it. In this video, we covered the temporary methods of birth control, the physical, the chemical, and the physiological, which is oral devices. A combination of these can be used to avoid pregnancy. So that's all for this video. Thank you. Take care. See you in the next.